The Centers for Disease Control and Prevention, America's top public health agency, just got a new boss, and the choice is raising eyebrows. President Donald Trump has appointed Jim O'Neill to serve as acting CDC director, replacing Susan Monarez, who was forced out after refusing to sign off on what her lawyers called unscientific and reckless directives. So, who is Jim O'Neill? O'Neill is not a doctor, not a scientist, and not a public health expert. He's a former investor with close ties to billionaire Peter Thiel, and a longtime critic of federal health regulations. In fact, he once suggested the FDA should approve drugs without proving they actually work, letting effectiveness be tested only after products hit the market. He's also a Washington insider, having worked at the Department of Health and Human Services under George W. Bush. But his biggest test will come now, as he takes over a CDC that's been shaken by firings, resignations, and deep conflicts over vaccines. Why is this controversial? O'Neill has supported the CDC's traditional vaccine role in public, but he's refused to openly break with Health Secretary Robert F. Kennedy Jr., who has long questioned vaccine safety. Within weeks, O'Neill may have to approve new CDC vaccine recommendations, decisions that will shape everything from measles to hepatitis policy. His predecessor, Monarez, lost her job after refusing to rubber stamp the panel's recommendations. 4 senior CDC officials have just resigned, leaving the agency with fewer scientific leaders at a critical moment. What's at stake? If O'Neill simply follows Kennedy's lead, the CDC could lose even more independence, fueling fears of political interference in science. If he pushes back, he risks the same fate as Monarez. Either way, the nation's top public health agency is entering one of the most uncertain chapters in its history. And remember, as acting director, O'Neill can only serve 210 days before he must step aside or be formally nominated. That means the next few months will be crucial for the CDC, and for America's vaccine policy. If you like the video, then don't forget to subscribe. It really motivates us to create helpful videos.